The nurse went to put in a feeding tube and put it in through his nose, and she started to struggle. And they told us, from what we could tell, it looks like the feeding tube that your son had went through his trachea and went into his lungs. Through our study, we've discovered there are probably at least 25% of children that are at risk of a misplaced feeding tube, and something needs to be done about it.
The standard of care in adults is to take an X-ray after every placement. The average patient in the ICU gets 2.5 feeding tubes, and the average feeding tube gets 1.5 X-rays to verify placement. So that's 4 X-rays per patient for feeding tube verification. In neonates, X-rays are avoided due to the risk of radiation. And so methods such as auscultation and aspiration are used. That involves using a syringe to blow bubbles in the tube and a stethoscope to hear the bubbles, or using the syringe to pull fluid and check if it's gastric fluid. Placement is essentially blind.
Feeding tube misplacement is a big problem, but even when the tube is properly placed, patients are routinely underfed. It's known that early and aggressive enteral feeding reduces length of stay and improves mortality, but I generally don't do it in my patients due to the risk of overfeeding.
Gravitas Medical was formed to reduce NG tube complications, optimize feed, and help patients thrive, while reducing the overall cost of care.